I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Doug Iliff of Topeka about depression. Thanks for being here today, Dr. Iliff.
You're welcome, Amy.
And now, what can you tell us about depression? How do we treat it?
Well, let's start with what depression is. You know, when I was in medical school, psychiatry was still under the influence of Freudianism. And with Freud, you went back and you looked at your childhood, you looked for toilet training behaviors or birth trauma or conflicts with your parents or double binding, and then you tried to sort those things out, and over a very long period of time you might work through the causes of your depression. Well, now we know that although Freud had insights, that's not really where depression comes from for the most part. It's mainly a biochemical process. Influenced, of course, by life experiences and different things that we go through that are hard. What people don't realize is that from a biochemical standpoint, many things that are not at all like depression, not labeled like depression, are really the same biochemical root, the same brain chemistry problem. You can wash your hands 44 times a day and we'd say that you've got obsessive compulsive disorder. You can be afraid to get on an elevator because you've got panic attacks. You can not want to go to your class reunion because you've got a social phobia. You can murder someone because you've got an anger disorder. All of those things may be the same biochemical problem in the brain brought out in different ways.
So does this mean treatment with medication?
It often does. There are two things we use now mainly to treat depression. One is cognitive behavioral therapy, which works through carefully behaviors that may be maladaptive to try to get them to work better for you. That can take a long time or a series of sessions. More often we'll use drugs right off the bat. Drugs and cognitive behavioral therapy, by the way, work better together than either one alone, although both are effective. The drugs we have now are extremely effective. They treat mainly three neurotransmitters in the brain: serotonin, norepinephrine, and dopamine. And they do so very effectively, and they're safe, and they aren't addictive, which is important. When I was coming up through medical school, all we had was tricyclic antidepressants. They weren't very effective, and I've sat up in the emergency room many times with someone who took an overdose watching a heart monitor. Nowadays, drugs are very, very safe, and we appreciate that a lot.
Yeah. What else can patients do to help themselves?
Well, they can certainly maintain a good life balance. Now, we've talked a lot about exercise. Is there anything that exercise does not cure? Well, it won't cure hip fractures or osteoarthritis of the knee, but it certainly helps depression. And it turns out, too, that outdoor exercise, in this case, is more effective than indoor exercise in treating depression. So I'll always advocate that. There's a peculiar type of depression we call seasonal affective disorder, or SAD. This is people who get depressed when the light drops outside, when we start getting short days and long nights. That can be effectively treated by full spectrum lamps, which you can buy on the internet pretty readily or find in stores.
Okay, great information. Thanks for being here today.
You're welcome.
Please join us next week for a new health topic discussion on House Calls.